Well, this is Politics Done Right with Egberto Willis, and we are live again. And now we are with, and I have to kind of read it, right? Kelly Coogan Gehr, and she is with, I tell you what, why don't you tell them your title with the union?
Yeah, so I'm with National Nurses United, and I am their Assistant Director of Public and Community Advocacy.
You know that you guys know exactly why I didn't say it, because it's one of those long titles.
The title is as bad as my name.
And the name is a long name as well.
That's right.
But anyhow, you are with the nurses. It's a nurses union. National Nurses United
That's
is a nurses union, but it's one of the unions that's advocating for single-payer Medicare for all. Is that correct?
That's correct. Our nurses are on the front lines of our country's healthcare crisis every single day. They see patients being denied care. They see families having to make really difficult decisions around, do we go bankrupt or do we pay our medical bills? Do we buy groceries? Do we pay our rent, or do we pay our medical bills? And so the nurses kind of see the human face of this pain and suffering, and so they're just natural leaders and natural spokespeople for this movement.
And many people would want to tell you that somehow Medicare for all is more expensive. Before you answer that, I want to tell folks, and there's a mathematical fact. In healthcare, profit is an expense. Okay,
we couldn't agree more.
It's a mathematical fact, and what I think is a problem a lot of times when we're selling this stuff is we fail to articulate that profit is an expense when we talk about healthcare. Why don't you explain to folks why Medicare for all, by definition, is more efficient and is something that is more humane?
Absolutely. So basically, right now, there are three pools of money that go into healthcare. You have individuals paying into the system, paying insurance, which the profit imperative of insurance is to deny care. That's how they make money. You have employers, and you have the government. And what a single payer system does is it brings those multiple payers, single payer being Medicare for all, it brings those multiple payers into one system. It regulates and controls pharmaceutical pricing. It regulates and controls hospital pricing. And it removes the middleman of the insurance industry.
That serves no purpose.
That serves no. The profit imperative is to deny care. I mean, when you see insurance, just automatically think denial of care. That's how the industry survives. That's how it thrives. You combine those, you do those price regulations, those price controls, you cover everybody for significantly less money. And what's interesting is that earlier this week, we had this Blauhaus Mercatus Institute study come out from a libertarian think tank proving this exactly, that they're saying, oh, well, you're going to spend $32.5 trillion if you take Bernie's bill, Senate Bill 1804. We already spend $36 trillion.
So it's lower.
It's lower.
$4 trillion lower.
Yes, and over time, because right now you have a family of four on average paying $19,000 to $28,000 a year for health insurance. You have individuals paying $6,000 a year for health insurance. And in many cases, these same people are very underinsured. So meaning that they're in a position where they're technically insured, but they can't afford their copays. They can't afford their deductibles, and so they are refusing to get the care they need. And so in order to bring up all the underinsured, in order to cover everybody, you still pay significantly less money than you do right now, where we have 30 million Americans going without care.
It is sad that it's so difficult to make a simple case. Because the case is not difficult.
It's not at all.
It is not difficult. It's just that we have the pressure of a corporatocracy out there that has the media in their pockets who refuse to give the real stories. Why not tell the real story of things we can see? Why not tell the real story of Canada? Why not tell the real story of England? Why not tell the real story of France?
That's right.
Why not tell the real story of Taiwan?
I think we're seeing a change, though, a little bit. I really do, because when this Mercatus study came out, there were lots of mainstream news networks that came out and said, look, the Mercatus study is actually saying, this libertarian study is saying we're actually going to save money. The issue has been, though, I think, is that for the last 20 to 30 years, there has been a campaign on the neoconservative, paleoconservative side to reduce government, essentially. And so they are concerned that, this is going to grow government.
Right.
And it's going to...
Which it will.
Which it will.
Yes.
And that, heck, the
But
government is going to give people the freedom to get the care they need.
But
What's the problem with that?
We have to start... what I say to organizations like yours is we have to expand the narrative. Right now, single-handedly, we can't talk Medicare for all single-handedly.
That's right.
We have to talk about true economic justice.
That's right.
We have to talk about economic systems, because our economic system is what demands that we capitalize everything.
That's exactly right.
And if we can
profit
decide,
imperative.
if we can decide that we are going to segment our society into the commons, the areas that are not going to be capitalized, and those that we allow to be capitalized, then we can get rid of the discussion. We can then say, healthcare is going to be a right, which is a part of the discussion.
Right. Yep.
We'll also say that
2/3 of Americans already believe that.
Exactly. And we get to those positions, we don't only have to argue the Medicare for all situation anymore. We can actually make it be, these are the commons and these are not.
Yes, that's exactly right. And I also think what's interesting and why I think it's so important that a union is really behind this movement is that for decades, since the Second World War, most unions have been what's known as like a labor management partnership or labor capital partnership. And if we win single payer, workers are going to take back substantial power, and especially in this era of Janus, where it's really primarily women of color workers being targeted, and they're going to be losing their health benefits as a result. If we get this, all of a sudden that employer control over worker health benefits is going to dissipate, and we will take back industrial power to a certain extent.
What is your membership?
Right now we have about 150,000 members nationally.
Excellent. And growing.
Oh, absolutely, and growing, even in right-to-work states.
Right. That is excellent. We need you so badly. We need you guys to help get the job done. We are doing our part. You are doing your part. We just have to educate the masses. Because once they're educated, they realize that, oh my God, how could we have accepted this for so long?
And right now we are doing that on a mass scale. We are working with the Knock on Every Door campaign, which is headed up by Becky Bond, who was a senior advisor to the Bernie Sanders presidential run. And we are literally across the country having conversations with our neighbors, with our communities, about why we need Medicare for all and why healthcare is a human right. Because we believe if there is not a widespread public demand for this, it's not going to happen. And we also believe that we are in this pivotal moment where it's close to happening. I mean, just a few years ago when the ACA was passed, progressives, they couldn't even talk about Medicare for all. And now, if you are a progressive, or at least you imagine yourself as a progressive Democratic politician, you have to somehow position yourself in relationship to Medicare for all. It is the litmus test.
And that's because you are doing the job.
Yes,
you mean
we have been doing it for decades.
The job and making sure that the masses are educated. And once the masses are educated, we get the tsunami effect. So,
and I want to say just one last thing is it's the Gandhi quote of at first they ignore you, then they laugh at you, then they fight you, and then you win. And we have entered into the era of the fight. And that is awesome. And I know it's going to be vicious. And I want to say, there are two threats. The one we already know about from the libertarian, the neoconservative angle. But there's also the threat of the extreme center, the neoliberal.
Thank you for saying that. The neoliberals, and there are a lot of folks in the liberal sphere don't like to talk about that. But that is so true. And you know what? That is what we intend or are attempting to bust this particular session. This particular session, that is what we must bust. And if we win.
Our biggest fear is that they are going to go forward with a single payer option. There is no such thing. If you have just a single payer option, you're going to have your sickest individuals taking it. It's going to set us up for failure. The only way single payers
Medicare
works is if you spread the risk.
It has to be spread.
That's the only way that single single payer is single
That's
payer.
the only word it works.
And so we need to also be out there massively educating, talking about not just with our members, not just with the public, but with legislators actually writing the legislation that there is no such thing as incrementalism in single payer.
No way.
Yeah.
Kelly Coogan Gehr, it was a pleasure speaking to you.
Likewise.
Thank you so kindly for being here with us.
Absolutely.
And we'll keep in touch. Let me tell you better. We bring in folks remotely as well. A few times when we want to educate more of the folks in a different context, we will be in touch.